My name is Talitha Cornelisi, and I will be submitting this assignment on March 15th for my G150 Structure and Function of the Human Body course. For this assignment, I decided to research the pathologic condition of type 1 diabetes, and I did a lot of research on what type 1 diabetes is and how it affects the body, and I will be sharing that information in this presentation. So type 1 diabetes is a type of autoimmune disease in which the body's immune system attacks a part of its pancreas. An autoimmune disease is a disease that affects the body through the immune system actually getting confused for a number of reasons and attacking healthy cells within the body. So type 1 diabetes is just one of a vast majority of autoimmune diseases. And type 1 diabetes is often referred to as juvenile diabetes because it is most often diagnosed in children, adolescents, and young adults, though it can be found in older people, just not as often. So there are a number of causes and contributing factors of type 1 diabetes. However, the true cause and reason that the immune system attacks those healthy cells is unknown. They have not discovered what causes that, but they do have some known contributing factors. Some of those include family history. Having a parent or sibling that has had type 1 diabetes increases your risk by up to 50%. Genetics, so just the presence of certain genes that they can test for, heighten the risk, though it's been found that you can have those genes and also not get type 1 diabetes, so it's kind of inconclusive. Geography has been shown to play a part in this. They have researched and shown that the further away from the equator you get, the more cases of type 1 diabetes are present. So they don't really know what that means exactly. They just know that for some reason, the further away from the equator you get, the more prevalent the disease becomes. And age is also another contributing factor to type 1 diabetes. There are two peak age ranges between 4 and 7 years old, and the other between 10 and 14 years of age. So there are other contributing factors that do come about when looking at type 1 diabetes. None of these are actually proven to cause it or even make it worse. They just have seen this in some of the cases of type 1 diabetes and think it may not just be a coincidence. Exposure to certain viruses such as the Epstein-Barr virus, Coxsackie virus, the mumps, and cytomegalovirus are a few that have been known to then be seen type 1 diabetes in people that have had these viruses. Early exposure to cow's milk, low vitamin D levels, nitrates in drinking water, introducing gluten into a baby's diet too late or too early, or being born with jaundice. And again, none of these are proven risk factors. They're more so just kind of interesting coincidences that they have noticed in people that have developed type 1 diabetes. There are a vast majority of warning signs and symptoms of type 1 diabetes that people can look for if they think they might have it or their child might have it. Some of these include increased thirst, frequent urination, bedwetting in a child that was previously potty trained, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision, and vaginal yeast infections in females. There are some other signs and symptoms, but these are the most prevalent, and a lot of them can go unnoticed if, just one or two of the signs or symptoms are present. Parents a lot of times may not, really understand that there could potentially be a very serious problem. So, type 1 diabetes affects the pancreas. It does affect the whole body, but it starts in the pancreas, and it messes with the creation of insulin. So the way a healthy body, someone without type 1 diabetes, would produce and use insulin, so the pancreas has cells within it that are called islets. So these islet cells actually produce insulin. That's their main function, is to produce insulin. So in a healthy person, that insulin is then distributed out of the pancreas and into the bloodstream. This is incredibly important because the bloodstream takes this insulin to pretty much every cell in the body and allows the glucose, or the insulin allows glucose that is brought into the body to be absorbed. And glucose is a very vital part of the human anatomy because it does provide the body and nearly every cell in the body with energy to do all of the processes that the body is responsible for. So when a person has type 1 diabetes, this whole system is thrown out of whack. The pancreas is actually part of something called the endocrine system, so when the pancreas isn't working fully and the immune system is attacking these islets and destroying them, the body is no longer able to produce insulin at all. And insulin is necessary for the body to survive. Without insulin, the body cannot survive. So if the islets are not producing the insulin and the insulin is not being released into the bloodstream, glucose then accumulates unused in the bloodstream, and the cells in the body aren't able to absorb it for energy. And this basically starves the cells of energy, and they're not able to, every cell in the body, in every single system that the body uses, we require glucose. And so if glucose is not present, the body doesn't have the energy to do the processes that it needs to do to be healthy and to survive. So because type 1 diabetes, because there's no, we don't know what causes it, we don't know what causes the immune system to turn on those islet cells, we don't have a way of curing it or even preventing it, but we can prevent type 1 diabetes from getting worse, and we can prevent it from creating hazardous and possibly deadly complications within the body. To do this, the number one way to do this is by monitoring and keeping a healthy blood sugar level. This is done through using insulin. It's a synthetic form of insulin that is actually put into the body and allows the body to use the glucose. So that's usually done through, there's a couple of different ways. You can have a shot that is done each time, usually multiple times a day. Or in extreme cases, a pump can be implanted into the body, and this pump allows insulin to be pumped in at a regular rate to keep the body and the blood sugar levels healthy. So another way that people with type 1 diabetes can try to stay healthy is wearing a tag or a bracelet or some kind of identifying marker, especially if they're going to be alone at any event or anything like that, saying that they do have type 1 diabetes, because one of the things that can happen in the event of type 1 diabetes is if they have an episode of high or low blood sugar, they can pass out, and people may not know quickly enough to get them the help that they need. Also, just things that most people do to stay healthy is keeping the yearly health exam and the eye exam, and making sure your immunizations are up to date, not drinking or using tobacco, which keeps everyone healthy, and then just keeping blood pressure and cholesterol under control, and basically just keeping your body as healthy as possible so that it's not having to work extra hard to make up for the fact that it doesn't have the insulin present. So that is, in a very brief description, what type 1 diabetes is, how it affects the body, and ways that people that do have type 1 diabetes can try to stay as healthy as possible. Like I said before, type 1 diabetes is an autoimmune disease, and unfortunately there is no known cure for type 1 diabetes. So it is very important for those who have been diagnosed to stay as healthy as possible.